But for a health point of view, taking this chlorine-containing water is actually oxidized water.
When I found out that the Kangen Water machine makes 7 types of water, I started exploring the high end, the 11.5, and the 2.5 end of that water. And on my exploration found out that the 2.5 water is bactericidal, and I am using it in my practice to help with bleeding. I use it to sanitize the mouth before I start working on the patients. I have used it in periodontal disease, and I've actually seen reversals of people's periodontal conditions. The teeth will actually tighten up with the use of the 2.5 water.
The Japanese have done a tremendous amount of work on using ionized water for wound care. There's a lot published in the Japanese literature and also now in American literature about using pH 2.5 water for bactericidal purposes. Staph aureus, for example, cannot survive in 2.5 pH water. The kill ratios are dramatic for this, and so it stands to reason that this would be beneficial for contaminated wounds or even infected wounds. The Japanese, for example, treat diabetic ulcers with ionized water with a low pH and find that to be extremely successful. They also have published a lot on it, and the before and after pictures are very dramatic. The pH 2.5 water has tremendous antibacterial properties against both gram-negative and gram-positive organisms.
The benefit for me as a physician to use water to treat bacterial infections is phenomenal. Number one, water's cheap. Secondly, it's very effective. We've seen through studies, and I've seen through my own observations with patients, that it's very effective. And thirdly, there's no side effects to it.
With the standard American diet, it's actually very sad. I mean, that is what it stands for. Standard American diet is filled with sugars and the high energy drinks and even the bottled waters, the potato chips and the pizza and the things that these children are getting in the vending machines. All of that is acidic. And now, with Kangen water, we have an alkaline water that actually will help reverse what conditions may occur using all those acidic items in our diet.
You think the skin is only young? No, artery is young too. So I did the CT scan my coronary artery, and my coronary artery didn't show any narrowing or stricture. Most of people who are eating a lot of beef, meat, and a lot of oxidized waters, they tend to develop more narrowing strictures. And many people, even in the 50s, they had the bypass procedure, the stent in, all kind of problems in the artery. Definitely, the drinking alkalized water and ionized water is more beneficial for us, for our health.
One of the things that you learn is called primum non nocere. Above all, do no harm. That is the duty of a physician. It dates back to Hippocrates. None of us want to do harm. What we should do, and I think when we're convinced of something that is really, truly good for people, we should go and recommend it to people.
Anytime our body sees protein that it doesn't recognize, we have the susceptibility to cause an inflammatory reaction or an allergic reaction. I think that helps me understand why so many asthmatics and why so many people with allergic rhinitis and other allergies do very well with this water in terms of controlling their allergies, because I really do think there's a connection there with incompletely digested proteins through the typical American diet that we consume.
Periodontal disease affects 75% of the population. And periodontal disease is a silent disease of the mouth. In other words, you don't really know you have it until it's too late. What I've found is that we do comprehensive cleanings on people to try to get their mouth healthy again. But we use as an adjunct the acidic water that we make here at the office with our Kangen machine, and we use it under the sulcus of all the teeth, in other words, around the teeth and the gums, to clean all the bacteria during our procedures. and we also send the patient home with the water, because I'm sure you've heard the eyes are the mirror to the soul, while the mouth is the mirror to the rest of the body.
There is so much evidence that we're doing good. Look at Japan. The country of Japan has the highest consumption of ionized water in the world. Now, I'm not saying it is necessarily a direct effect, but they are also number one in overall health care in the world and number one in longevity in the world. When we compare that to the United States, we're number 38 in longevity and in overall health. The Cubans have better health than we do.
We need to respect the fact that we have all these built-in mechanisms to help us fight disease, to maintain our health. But we need to support ourselves in that healing process by eating natural foods, by drinking the right type of water, by managing stress, by getting plenty of exercise and plenty of oxygen to our lungs.
This is a very important. You just change your diet very little bit. Enjoy the health, enjoy your longevity too. I think number one, most important.
Excited that Kangen Water is here to help both children and adults alike. I'm having great results with it in my practice, and my patients are loving it.
I've had the great fortune in my life to have graduated from one of the finest medical schools in the world, Harvard. I was trained in the Harvard residency program. I've spent my entire professional career affiliated with that institution. One of the best things, next to being affiliated with this great institution, has been my discovery of Kangen Water.
For those of you who are trying to optimize your health and trying to do everything you can to have good health, to maintain your health, preserve your health, my plea is just try the water. There's nothing more simple, there's nothing more inexpensive, and there's nothing more powerful and effective than Kangen Water.
In Japan, they have a saying, Mizu wo kaereba, jinsei ga kawaru. Translated, change your water, change your life. Do yourself and your family a